In 2024, America spent $5.3 trillion on healthcare, more than any nation on Earth, more than the GDP of Japan, and ranked dead last among developed countries in keeping its people alive. Of that $5.3 trillion, $4.5 trillion flowed through private insurers, hospitals, and pharmaceutical companies. Not the government, not a public fund, private industry. In the next 18 minutes, you'll discover how a single backroom conversation in Nixon's Oval Office in 1971 created a system designed not to heal you, but to profit from your sickness. And if you think this is just an American problem, UnitedHealth Group, the company at the center of this story, already operates in 150 countries. The model that bankrupts American families is going global. Your country could be next. To understand how 330 million people got trapped in the most expensive healthcare system on Earth, you need to understand what Americans actually get for their money. Meet Maria. She's 43, a teacher in Phoenix, Arizona. In 2022, she found a lump in her breast. Her insurer denied the biopsy, not medically necessary. They denied the follow-up scan. Then they denied the first round of treatment. By the time the appeals were exhausted, the cancer had spread. Her husband, a mechanic, took a second job. They still owe $87,000. Maria is not exceptional. She is the system working as designed. Americans spend $15,474 per person per year on health care, roughly triple the OECD average. Yet American life expectancy is 78.4 years, 4.1 years shorter than comparable nations. 27 million Americans have zero health insurance. Medical debt is a leading cause of personal bankruptcy, about 530,000 families per year. And at least $200 billion in medical debt sits in active collections right now. About 41% of U.S. adults carry medical or dental debt. But America didn't always have the most expensive health care in the world. This system was built deliberately, starting with a decision nobody voted for. The year is 1942. America is at war. Factories are running 3 shifts. Every able-bodied man is either fighting overseas or building tanks at home. And President Roosevelt has a problem. Wages are spiraling out of control. So he signs the Stabilization Act of 1942, freezing wages to fight wartime inflation. But here's the detail that changed everything. The act explicitly excluded insurance and pension benefits from the freeze. Employers couldn't raise your paycheck, but they could offer you health insurance as a perk. Before that law, only 9.8% of Americans had any medical insurance. By 1946, nearly 30%. Not because anyone planned a healthcare system, because of a tax loophole. The Revenue Act of 1942 taxed corporate profits at 80 to 90%, but employee benefits were fully deductible. Health insurance wasn't born as a social program. It was born as a write-off. What started as a wartime workaround became permanent. Employer-based health insurance was never designed. It was an accident of tax policy that nobody bothered to reverse. Keep that in mind, because what happens next was very much on purpose. Fast forward to 1965. The government steps in with Medicare and Medicaid, covering the elderly and the poor. But the private insurance industry keeps the working population. Federal health care spending grows from 4.1% of the budget in 1961 to 11.3% by 1973. The system is already growing teeth. And then comes the moment that defines American health care for the next 50 years. February 17, 1971. The Oval Office. John Ehrlichman, Nixon's domestic policy advisor, walks in with a pitch. He's been lobbied by Edgar Kaiser, son of the Kaiser Permanente founder. Ehrlichman tells Nixon about Kaiser's model, and this is a direct quote from the White House tapes. All the incentives are toward less medical care because the less care they give them, the more money they make. Nixon's response? Well, that appeals to me. Not bad. The next day, Nixon publicly announces he will push legislation to provide Americans the finest health care in the world. On December 29, 1973, he signs the Health Maintenance Organization Act, opening the door for-profit health insurance nationwide. Nixon told America he was giving them the finest health care in the world. But the tape tells a different story. The system wasn't designed to heal you. It was designed to bill you. Here's what Nixon's tape reveals that your textbook won't tell you. The entire architecture of American healthcare was built on one principle. The less care they give you, the more money they make. This isn't a bug in the system, it's the original design specification. The HMO Act didn't just allow for profit insurance, it overturned decades of non-profit medical practice. It made denial profitable. And once the profit motive was unleashed, the industry built a machine to extract maximum revenue from every American body. So the profit motive is loose. Now let me show you the machine it built. The denial machine. The business model is elegant in its cruelty. Collect premiums, deny claims, keep the difference. That's it. That's the whole thing. But they needed a mechanism, so they invented something called prior authorization, a system that forces your doctor to get permission from the insurance company before treating you. The industry has a pretty word for this: utilization management. What it actually means? A 23-year-old claims processor sitting at a desk in Nebraska can overrule a cardiologist's treatment recommendation. The doctor spent 12 years in medical school. The claims processor uses a checklist, and denial rates doubled in the past decade. Remember those three words: delay, deny, depose. Someone inscribed them on bullet casings in December 2024. We'll come back to that. But here's what you need to know now. Those aren't a protest slogan. They're the insurance industry's actual operating manual. The lobbying machine. Now, you might think Congress would step in, protect the people, do their job. You'd be wrong. During the fight over the Affordable Care Act in 2009, the insurance industry spent more than $1.1 billion lobbying Congress. They hired 4,525 lobbyists, 8 lobbyists for every single member of Congress. Insurance companies secretly funneled tens of millions to the U.S. Chamber of Commerce for anti-Obamacare ads. The result? The public option, the one provision that could have actually broken the insurance monopoly, was killed. And that's just insurance. Pharma, the Pharma Trade Group, spent $31.7 million lobbying in 2024 alone. The broader pharmaceutical industry? Hundreds of millions more. These companies don't just sell drugs, they buy lawmakers. The insulin example, a crime in miniature. If you want to see the entire machine condensed into one product, look at insulin. A vial costs about $2 to $4 to manufacture. $2 to $4. American insulin users spend $3,490 per year. Canadians, $725. Total U.S. insulin spending, $28 billion. Canada, similar demographics, larger land mass, $484 million. U.S. insulin prices rose 10.3% over the study period. Canada, 0.01%. Same molecule, same vial, same disease. The only difference is which country lets the insurance industry set the price. Let that sink in. The administrative bloat. Here's the kicker. The system doesn't just charge you more, it wastes what it takes. Wasteful administrative spending in U.S. healthcare is estimated between $265 billion and $935 billion per year, depending on how you count it. For every doctor actually treating patients, there are multiple administrators processing claims, fighting denials, and generating paperwork. The system has created an entire industry whose job is to say no. McKinsey estimates that 30 known interventions could save $265 billion annually. The math works. The solutions exist. But implementing them would cut into industry profits. So nothing happens. Nothing changes. The machine keeps running. But the insurance companies didn't build this machine alone. They had help from the very government that was supposed to protect you. And then the insurance industry pulled off its greatest trick. It turned the Affordable Care Act, the law designed to destroy it, into its greatest profit engine. Watch these numbers. In 2010, UnitedHealth Group stock was trading at $25. By 2023, $550, a 22 times return. The ACA, which was supposed to end the insurance trap, became the industry's best-performing growth catalyst. Congress handed them 20 million legally mandated new customers. Americans now required by law to buy insurance from the very companies that had spent over $100 million fighting the legislation. The insurance trap was complete. Americans were now legally required to buy a product designed to deny them care. So let's pull back the curtain on the full machine. Because what you're about to see isn't incompetence, it's architecture. The perverse incentive structure. The clearest way to understand the machine is to follow $1. A premium payment enters UnitedHealth Group. A fraction of it, the medical loss ratio, flows toward patient care. Federal law says that ratio can't drop below 80 to 85%. Sounds reasonable, right? 80 cents of every dollar going to actual health care? Here's the trick nobody explains. The remaining 15 to 20% becomes operating revenue, and the bigger the total premium pool, the bigger that slice gets. So the real incentive isn't to reduce healthcare costs. It's to inflate them, because 15% of a bigger number is a bigger profit. The system rewards the disease. It feeds on it. Now meet Andrew Whitty. He's the CEO of UnitedHealth Group, the man who inherited the job after what happened to Brian Thompson. In 2024, Whitty earned $26.3 million in total compensation. His performance metrics, disclosed in SEC filings, public record, include the medical loss ratio. In plain English, the less sick people get paid for, the better his bonus. That's not an accusation. That is literally what the company filed with the Securities and Exchange Commission. UnitedHealth Group generated $400.1 billion in revenue in 2024. Let that number land for a second. That's larger than the GDP of over 170 countries. One insurance company, and they're not alone. The top 5 health insurers, UnitedHealth, Elevance, CVS, Aetna, Cigna, and Humana, collectively generated over $1 trillion in revenue. Do the math. $1 trillion in revenue, from a system designed, on a recorded tape in the Oval Office, to profit from denying care. Why reform always fails. Now you might be thinking, surely somebody can fix this. Every president promises to, and every reform attempt hits the same wall. The industry that profits from the status quo funds the politicians who write the laws. 10 states still haven't adopted Medicaid expansion, leaving 1.4 million Americans uninsured with no affordable option whatsoever. Not because the math doesn't work, not because it's controversial, because the insurance lobby doesn't want it. And then there's the revolving door. Former insurance executives become healthcare regulators. Former regulators become insurance lobbyists. The people writing the rules and the people profiting from breaking them swap desks every few years. It's not a conspiracy, it's a career path. Here is a concrete example of how this works. Marilyn Tavenner ran the Centers for Medicare and Medicaid Services, the federal agency that regulates insurance. She left that job and became the CEO of America's Health Insurance Plans, the industry's main lobbying group. The regulator became the lobbyist. The watchdog became the guard dog. And she is not an exception. She is the template. International comparison. What normal looks like. Now, at this point, you might be thinking, maybe healthcare is just expensive. Maybe this is what it costs. So let's look at what the rest of the world does, because every other developed nation figured this out decades ago. The United Kingdom, universal coverage through the NHS, funded by taxes. Per capita spending, about $5,000. Life expectancy, 81 plus years. Germany, multi-payer system with mandatory insurance, price-controlled drugs. Per capita, about $7,000. Life expectancy, 81 plus. Japan, universal coverage since 1961. Per capita, about $4,600. Life expectancy, 84 years, the highest in the OECD. Canada, single payer for hospital and physician services. Per capita, about $5,700. Life expectancy, 81 plus. Do the math. Every single one of them spends less. Every single one of them lives longer. The United States spends $15,474 per person and ranks dead last in outcomes. They solved this problem in the 1960s. We chose this instead. Why easy fixes won't work. Just regulate drug prices. Pharma spent hundreds of millions lobbying in 2024 to prevent exactly that. Just expand Medicare. Insurance industry revenue would collapse overnight. They will spend billions to stop it. Just increase competition. The top 5 insurers control over 80% of the commercial insurance market. That's what 2 decades of unchecked mergers and acquisitions looks like. There is no real competition. There never was. Every obvious fix threatens someone's trillion-dollar revenue stream, and that someone has more lobbyists than Congress has members. So what does the most expensive healthcare system in human history actually deliver? The answer is written in death certificates. American life expectancy, 78.4 years. Comparable nations, 82.5. That gap, 4.1 years, is not bad luck. It's not genetics. It's not lifestyle. It is the measurable cost of a system that was designed in a room in 1971 to prioritize profit over people. The United States has the highest rate of preventable deaths among developed nations. Last in access to care, last in equity, last in health outcomes among 10 comparable countries. But here's the detail that should make you furious. The U.S. ranks second in care process, preventive care, patient safety, quality of treatment. American doctors and nurses are among the best in the world. They're not the problem. The system they're trapped in is the problem.
American life expectancy, 78.4 years. Comparable nations, 82.5. That gap, 4.1 years, is not bad luck. It's not genetics. It's not lifestyle. It is the measurable cost of a system that was designed in a room in 1971 to prioritize profit over people. The United States has the highest rate of preventable deaths among developed nations, last in access to care, last in equity, last in health outcomes among 10 comparable countries. But here's the detail that should make you furious. The U.S. ranks second in care process, preventive care, patient safety, quality of treatment. American doctors and nurses are among the best in the world. They're not the problem. The system they're trapped in is the problem. Remember Maria? Her husband is still paying. He'll be paying for the next 11 years according to his repayment plan. And here's what the system does next. It multiplies. Her husband stopped going to the doctor himself. He can't afford the premiums on his own care. One denied claim produced 2 uninsured people. The machine feeds itself. And Maria is not an outlier. About 530,000 families file for medical bankruptcy every year. 2/3 of all bankruptcy filers cite at least one medical contributor. 41% of U.S. adults carry medical or dental debt. 24% have past due medical bills they simply cannot pay. And here's what makes this uniquely, specifically, exclusively American. The United States is the only developed country where medical bankruptcy exists at scale. In the UK, Germany, Japan, Canada, medical bankruptcy is essentially unknown. It doesn't exist because those systems weren't designed to extract profit from sick people. Healthcare spending hit 18% of GDP in 2024. Nearly $1 in $5 the American economy produces goes to healthcare. Projections say 20.3% of GDP by 2033. Per capita spending projected to reach $24,200. The system isn't just failing Americans, it's consuming the economy itself. It's an economic boa constrictor, wrapping itself around every paycheck, every business, every government budget, and squeezing a little tighter every single year. Small businesses that can't afford employee coverage lose talent to corporations that can. Workers who hate their jobs stay anyway because their family's health insurance is tied to that paycheck. Economists have a name for this: job lock. Millions of Americans are imprisoned not by bars, but by the fear of losing their medical coverage. That's what a system designed to extract rent from sick people does to an entire economy. For decades, Americans were told this was the best healthcare system in the world. Then, on a cold December morning in 2024, December 4th, 2024, early morning, Manhattan. Brian Thompson, the CEO of UnitedHealth, walks toward the New York Hilton Midtown for an investor conference. He doesn't make it inside. The bullet casings found at the scene are inscribed with 3 words: delay, deny, depose. Now, here's where this story takes a turn nobody, not the media, not the industry, not Washington, was prepared for. UnitedHealth's condolence post on Facebook received over 100,000 laughing reactions. Americans didn't flood social media with sympathy. They flooded it with their own stories: denied claims, bankrupting bills, dead relatives who couldn't afford treatment. Polling showed 41% of young Americans found the killing acceptable. 17% of all Americans. The shooter, Luigi Mangione, became a folk hero, not because Americans condone violence, but because the system had made them so desperate that a murder felt like justice. The insurance industry spent 50 years designing a system built on 3 words: delay, deny, depose. On December 4th, 2024, someone wrote those words on bullet casings. The question isn't whether that was justice. The question is, what kind of system makes millions of people think it was? The U.S. health insurance industry built a $5.3 trillion machine that profits from denying care to sick people, and it's still running. And if you haven't seen our deep dive into America's housing market, the $45 trillion trap that's making homeownership impossible, check it out. Links on screen. Now I want to hear from you. Drop your take in the comments. Should America scrap private insurance entirely and go single payer, or can this system be reformed from the inside? Let me know below.